Hi everybody, welcome to our first series of our topic on heart failure. It's just some general knowledge to share with everyone. Thank you.
Samantha. I'm
Hold
a
on, wait a minute.
physiotherapist. And today we have our guest speaker, Dr. Michael MacDonald. So, Dr. Michael, would you like to
Hello.
introduce yourself?
I'm Mike MacDonald. I'm a cardiologist at the Harley Street Heart and Vascular Centre, and I have an interest in heart failure, which Samantha and I will be discussing today.
Great. Okay, so as you hear, today our topic is on heart failure. I guess our public generally gets confused between just normal aging and heart failure. So, could you actually educate us more on what exactly is heart failure?
Sure. Okay, so heart failure actually are kind of complicate the issue. People get mixed up between heart failure and things like heart attacks. I think it's important that you understand, first of all, how the heart works, and then you can understand what actually heart failure is. So basically the heart, I've got a model here, hold on. So this makes it a bit easier. So the heart is basically, it's a muscular pump, and you've got chambers that collect blood from the body that pump the blood to the lungs to get oxygen, and then up into the aorta, which then goes out to the body, goes to the brain and all the different organs. And it functions as a
Dr.
pump.
Michael,
Yeah?
sorry, I can't really see the heart.
You can't see it, okay, sorry. So it functions as a pump, and it's a muscle. It's basically a muscle, and it pumps 60 times a minute, and it's supplied by its own blood supply. So it's got coronary arteries, and these supply it with blood. And it's important that you know what the coronary arteries are, because the most common cause of heart failure is when someone has a heart attack. And a heart attack is when you have an acute occlusion of one of these arteries, and it leads to damage to the heart, and part of the heart muscle then fails to work properly. So that's a heart attack. You then have heart failure. Heart failure is basically any condition that leads to the heart to not be able to do its job properly. The common causes of heart failure are heart attacks, which leave a damaged heart, any valve problems. If I show you the heart has a number of different valves here. You've got the tricuspid valve on the right side, pulmonary valve going up to the lungs here, your mitral valve, and the aortic valve. And if these start to malfunction, then the heart is unable to do its job of pumping blood properly. That in itself can cause heart failure as well. Another really common condition of heart failure is high blood pressure. So if you have high blood pressure for a long time, it causes the heart to stop working properly too. So heart failure itself is a process when the heart is not doing its job, which is different from normal aging. Not everybody who gets older gets heart failure.
Wow, there's actually a lot to know.
Yeah.
Can we just have a better understanding of how heart failure would present itself, like the signs and the symptoms that we will feel?
Sure, there's some common symptoms. The first one's breathlessness. So people start to notice that they're getting a little bit more breathless than normal when they're out walking or climbing stairs. The next one is general tiredness or fatigue. People generally feel a bit quite tired, maybe not as refreshed after they're sleeping. The other common one is swelling of the legs, and people tend to get kind of swelling of the ankles. And the way you can look at that is if you press your finger into your ankle, you'll often see a little indentation there. The other types of symptoms we look for when people come to our surgery is, are they having shortness of breath when they're lying flat? And are they waking up at night feeling short of breath as well? So they're the common presenting symptoms of heart failure.
All right, that's great. How about the medications? Usually, is there a guide to it?
Yeah, so when we have somebody with all these symptoms of heart failure, let me just talk you through what happens to a kind of standard heart failure patient when they present. So the first step is getting the diagnosis correct, and we would do an ultrasound of the heart to see if the heart function is affected for some reason, to have a look at the heart valves to see if there's any damage to the pumping function. We might do some blood tests also to assess to see if someone has heart failure, to look for the cause. We do our tests, we look for the cause of the heart failure, and if there's something that can be dealt with, that can be reversed, then we'll always treat that cause. So that might be if someone has a severe blockage in one of their heart valves, then we would always try and treat that if that's the cause of the heart failure. Now, one of the most common types of heart failure is something when the main pumping chamber, the left ventricle, is not able to push as much blood out of the heart as normal. There's a standard set of drugs for this type of heart failure. It's called heart failure with reduced ejection fraction. And there's a lot of drugs we have now over the last maybe 20, 30 years, lots of big clinical trials that have shown that these medications, they make you live longer, they make you feel better, they get rid of a lot of the symptoms of heart failure like swelling of the legs, and they stop you ending up in hospital. Broadly, the names of these groups of drugs are kind of ACE inhibitors or angiotensin receptor blockers. You've got beta blockers and aldosterone antagonists and diuretics or water tablets. And there's a few other types of drugs that we can use. So there's actually quite a lot of medication that the average heart failure patient ends up needing to take. And often these tablets are for the rest of their life as well. But when they take them, they feel better and they definitely do better in the longer term.
Okay, so hearing what you just said, may I just clarify, does anyone really get better from getting heart failure? Can they recover from it? Can they reverse it?
Yeah, that's a really, really common question. And it depends, unfortunately. So you've got a group of people that get worse. They don't do any better with treatment, and they maybe end up getting special types of pacemakers, or they end up getting a heart transplant, or perhaps more rarely, they maybe get something called a ventricular assist device, which is like an artificial heart. And there's a group of patients that don't really do any different. They stay the same. But then there's also a group of patients that do better. And it very much depends on the cause of your heart failure. So an example might be if somebody presents with heart failure caused by aortic stenosis, that's a very tight heart valve, then if you fix the aortic stenosis, then often the heart failure will get better.
Oh, okay, nice. There's a lot to know, really, and great to know.
Thank you all for watching. That's the end of episode 1. Please subscribe to our channel for more informative videos like this and look out for the next episode. Bye!